First of all, I'd like to thank the organization for inviting me and giving me the opportunity to present our data. And this is what I'm going to have now. The title of my presentation is Concurrent Low-Dose Focused Ultrasound with Chemotherapy in Abdominal Tumors. Okay, so well, we are a clinical unit. There is in a university hospital, but with clinical responsibilities, and this is what we do. We started our HIFU oncological program in 2010, so it's now more than 6 years. We have treated more than 180 patients now. We have a good thing there that it's we have reimbursement for these patients. And so that allows us to do cases more easily in terms of doing in terms of doing the cases without problem for the patients. And also we have this interesting thing, which is we are being able to attract a lot of patients from outside our region. This is the amount of patients we have treated until now. And the purpose of this presentation is to show you that we from the consuls of the people to our unit, 2 out of them are really suitable for ablation. So the rest were not candidates for ablation. So what we did was try to find out something that could help more or less 50% of the patients that call us, and there are stage 4 advanced abdominal tumors. And so what we thought is that we could be using the device that we had as an hyperthermia device. So hyperthermia, it's an interesting field that causes all these things that we have in this slide: tumor cell death, tumor DNA repair, activates heat shock proteins and dendritic cells, increases lymphocyte trafficking, increases blood flow and vessel perfusion. So we have an unmet need there in stage 4 abdominal tumors. Chemotherapy alone in this case lacks enough efficacy because of these patients are normally, after several treatments, they have scars and chemotherapy cannot reach the tumor properly. The hyperthermia itself shows efficacy and also as an adjunct to chemotherapy, and focused ultrasound pulse hyperthermia may add an increased tumor penetrability effect that we want to explore in this study. And also, this is a good thing that we can use either MRI or ultrasound-guided devices. So the endpoints of this study are safety, immune response, tumor cytoreduction, quality of life, treatment response, and survival. So patient selection, we were going to treat advanced stage 4 patients, liver metastases from colorectal cancer, liver metastases from pancreatic cancer, and abdominal sarcomas. We want to include patients that have failed to at least 1 chemotherapy line, patients that are not candidates for tumor ablation. We would do blood tests, including immunological values, day before the treatment and day after the 3rd treatment. And we would do imaging before and after the completed 3 treatments, and we will apply a quality of life test to these patients. This is the type of setup that we are going to do. Chemotherapy, it's on day 1 and day -1, day before the day of the chemotherapy, and the day after the chemotherapy, the patient will have a focused ultrasound pulse hyperthermia procedure. The procedure is done under sedation, just because the patient is going to be almost 1 hour in this position, and we want the patient to be relaxed and don't move. Not because this procedure is harm or it may cause pain, but just for the comfort of the patient. The position is adapted to the main tumor placement. It lasts between 45 minutes and 1 hour. We would use between 80 and 100 watts, the HIFU intensity, 40 to 45 centigrade degrees, and no admission needed for the patient. These are some of the images that show us that we cover in 3D the whole amount of the organ or where the tumor may be placed. This is the series. We only have done till now 2 cases. One that I'm going to explain now. This is case 1. It's a male, 46-year-old, with pancreatic cancer with multiple liver metastases. In January 2016 was was done with biliary stent, 3 cycles of gemcitabine plus nab-paclitaxel, which is the standard treatment on these cases. She showed progression. In March 2016, he started with FOLFOX, fluorouracil and oxaliplatin, and he showed some kind of a stable disease. And then we started on our protocol with the same FOLFOX plus focused ultrasound pulse hyperthermia. And just before I came here, we did a scan of them, and there was a partial response with reduction of the pancreatic lesion and reduction in size and number of the liver metastases. We see here the main tumor with the stent, with the biliary stent, and some of the hepatic lesions. And this is the treatment. We do it on the liver between the ribs. So here the shadow of the ribs, and we do the treatment in between. The case 2, it's a female, 62 years old, with a restrictive cardiac failure, with a retroperitoneal leiomyosarcoma non-resectable, and he started treatment with doxorubicin and then pazopanib that had to be stopped because of toxicity. Hematologic toxicity, and in March 2016 she started treatment with trabectedin that had to be stopped also with hematologic toxicity, and she showed progression. And we included in our protocol with pazopanib, that was one of the drugs that showed some kind of response with a lower dose because of the toxicity, plus focused ultrasound pulse hyperthermia. Now is with a stable disease with minimal reduction of the main tumor. This is the huge retroperitoneal sarcoma, and the treatment also planified here. So we cannot conclude anything now because we just started that. Now it's in a work in progress, but we wanted to present that because this is an opportunity to share with you these cases. So we cannot conclude anything, but we can make some comments. There are medical needs on this case where focused ultrasound pulse hyperthermia can be useful. The hyperthermic techniques are effective in advanced solid tumors. In our experience, we haven't seen toxicity nor complication, but we have, a very low number of patients. Clinical results are encouraging till now. We cannot share quality of life or immune tests because it's too early to evaluate those cases. And we think that concurrent focused ultrasound pulse hyperthermia plus chemotherapy is feasible and may be of help in stage 4 advanced abdominal tumors. This is our group, and thank you, and I'll be ready for questions.
Questions from the audience. And while anyone's coming up, go ahead. I have one quick question. How do you know you're doing hyperthermia? Because you're using ultrasound imaging. How are you estimating the temperature that you're achieving with the lesions? I'm sorry, I guess I stole your question.
Exactly, I don't know. So I don't have thermometry, and with our device, we just can assume that we are doing this number. We have an ablation of between 60 and 80 degrees when we deal with between 300 and 400 watts. So our assumption is around 100 watts would be the 45 degrees that we are assuming, but we don't know it.
Did you do any modeling or at least some calculations to determine that power, or is this just a rough estimate? You know that it's below ablation?
It's a rough estimate.
Okay.
Yes.
Other questions from the audience? Okay, thank you very much.